We're Group 2. My name is Sophia.
I'm Matt.
I'm Jen.
And I'm Kelly.
And our project is focusing on developing a preventative injectable for alveolar osteitis. Over 5 million people each year get their wisdom tooth removed. 1 to 4% of those patients experience post-operative alveolar osteitis, which is more commonly known as dry sockets. This is currently treated with chlorhexidine. This image shows how a blood clot forms after a tooth is extracted. However, when it's dislodged, it leaves an empty space where nerves and bone are exposed. This can be extremely painful. According to peer-reviewed literature, those who are more prone to alveolar osteitis include those who have poor hygiene, women, those from the age of 40 to 45, smokers, and drinkers. Our goal is to develop a preventative therapeutic implant for maxillofacial surgeons to sell to their patients. We'll encourage these surgeons to promote this to those who are prone to alveolar osteitis. Our product will overall decrease post-operative complications with alveolar osteitis.
So for our approach and to prevent alveolar osteitis, the method we chose to go with is to inject a hydrogel. The hydrogel we chose to use is technically called a MAP, which stands for microporous annealed particle. It's a PEG-based hydrogel, which means it's really biocompatible. Along with the hydrogel, there's a couple other things that are going to be injected. There's going to be RGD peptide in the hydrogel. This allows the gel to really kind of adhere to the gums and the surrounding tissue that the tooth was removed from. On top of that, there's annealing solutions and cross-linking solutions. Most notably, one of these is factor 13A. It's a really common enzyme used in blood clotting, and it's used in this gel to kind of solidify the gel. And lastly, there's antibiotics. For our antibiotics, we chose to use 4 different kinds. Not all at the same time, but there's 4 different gels with 4 different antibiotics. The reason for that being, if the patient is allergic to one specific type of antibiotic, they can get a gel with a different antibiotic. And the antibiotics are really good for preventing infection, reducing pain, and reducing the risk of dry sockets altogether. So to use our product is really fairly simple. First step is injection. Once it's injected, it'll cross-link, anneal, and adhere, which means it'll solidify and kind of adhere to the surrounding tissue. Once it does that, and after some time, cells will kind of grow into the gel itself. Once the cells grow into the gel will start to degrade, and then you'll get the release of antibiotics, and eventually the gel will just degrade to nothing as more tissue moves in.
So associated with our product is obvious costs and benefits. So the production and testing of our product, as well as travel to obtain VOC or voice of customer, will be costly, as well as the fact that our product will be purchased by dental offices or dental surgeons, which this cost may be deferred to patients or insurance companies. There's also a risk of excess exposure to antibiotics, possibly creating resistant bacteria, but we believe that the benefits far outweigh the costs, which means reducing patient risk to alveolar osteitis and overall pain. And we're also decreasing the healing time, and there's a low level of skill or training associated with our product. It's just an injectable gel, it's super simple, and it's resorbable, so only one appointment is necessary, and then it resorts on its own.
So now that we've talked a little bit about our product, let's talk about what's currently being used on the market to treat alveolar osteitis. The first of these is chlorhexidine, which is an antiseptic. An issue with that is that there's common allergies to this antiseptic, and it can cause swelling and desensitization. Another is antibiotics, but again, this can only kill bacteria at the site. It does nothing to promote wound healing. Another is resorbable dressings. The use of these remains controversial because they are not well researched. Oftentimes, these wash away into the body and can initiate a foreign body immune response. So why is our product better than these alternatives? We have 4 different antibiotics that can be used in our gel, and each one can be personalized to the patient if the patient is allergic to an antibiotic or if the patient wants to use a certain antibiotic. There is no foreign body response. Again, it's a PEG gel, so it's very biocompatible. It's preventative versus reactionary. That means that there has to be very little pain involved. The clot never has to dislodge. This will be put in before that incident happens. And it promotes wound healing by protecting the clot itself. So foreign substance cannot enter the cavity, and the clot can be left to heal on its own.
Thank you.